जो याद रखना है, रखना ही है. Everyone has to remember. This is same for every student whosoever is into the medical science. जो इंडिया में पढ़ रहे हैं या बाहर पढ़ रहे हैं या यूएस में पढ़ रहे हैं, any country, it is same for everyone. So then it is not so that those who are over here they are eating 1 kilogram of badam every day. कुछ नहीं यार. Reset everything. Past is past. मेरे नीट में इतने आया उतने आया, this happened, that happened, बीमार हो गया, यहाँ गई थी, वहाँ, whatever, forget, right? Forget. Put a cut. From today, it is a new journey, and it is in this journey you are in direct, strict competition with every student whosoever into medical science. बस जो गेम है वो यहाँ से शुरू है. Who is caring about that how much you scored in 9th standard and 10th standard? Means I was a very, मतलब आप लोग तो इतने अच्छे हो, you are such a, I was not at all a good student, not at all. क्या क्या लिख के आता था एग्जाम में स्कूल में, तो they used to call my parents कि he has written about Cazen's disease. मछली पे ऐसे लिखना था, I wrote about Cazen's disease. I wrote that whales do not suffer from, say, seasickness because of their hyperflexible chest and वो सब लिख दिया. My father used to laugh, दया करो, it happens, कुछ नहीं, nothing to worry. But when it comes to your subject, be very clear. And I tell you, if you know your subject well now, so you'll find that food is tastier and sleep is better. किसी को भी बोलो या ना, we can't cheat ourselves. When we don't know our subject, तो वो अंदर कुछ होता है. We are scared, यार कोई पूछ ना दे, कोई ECG हाथ में ना दे. Be the boss, यार. And do let me know. अच्छा बुरा कभी भी, always talk. ठीक है. So this is the answer of your question, that if you are reading more books, so yes, you can always integrate, you can always add those extra points. Okay. Next is regarding the time management. Time management. Everyone has got this. Someone has got 24 hours. Right? कुछ लोगों के पास 40 घंटे होते हैं एक दिन के. Is it so? Everyone in this world has got 24 hours. The answer is, it is not the time management. It is how to stop time wastage or time leaks. This is where, say, writing your diary, it matters a lot. It matters a lot. Oh, you have written such a long, so right now I wouldn't be able to read this thing. Right? It's really very long. But okay. The points which you have written, they are really good. The phone addiction, all those social media, दिमाग खराब कर देती. Social media, all those things. I told you about digital sannyas. Do you remember this? Just for 2 hours. For 2 hours, you won't be touching your cell phone before you go to sleep. Okay? So Neha, yes. Monalika, I'm doing. Okay. Anyone else who is still sticking to this principle? Still following it till now? Nishat, very good. Sayali, yes. Puja, Ir. Okay. Avantika, Viraj, nice. कोई बात नहीं, अब फॉलो कर लीजिए. हर्षवर्धन, फैंटास्टिक. निर्माण 30 मिनट, कोई बात नहीं, 30 मिनट का 1 आवर हो जाएगा. But can person walk even after meniscal tear of knee? Well, should not. It should not. It should be repaired properly because meniscus tear, right? It is bad. Well, it depends upon whether it is a medial meniscus or lateral meniscus. But if it is when in knee, right, we'll be talking in more detail about it. But yes, person should not walk. It should be repaired first. And if the tear is more, it requires surgery because it won't heal by itself. So I'm happy with at least the number is more than 10, 12, 14, 15. This was something which was bad. That just before 2 hours you go to sleep, right? Take a digital sannyas. Digital sannyas means phone ko dur rakho. If you can do that, you'll find that your sleep quality has improved. Otherwise, koi bhi chota sa WhatsApp, right? If someone has put some comment and unnecessarily your sleep is disturbed. So don't do that. So this is one. Regarding this time management part, when you write diary, in that diary you will find that अरे किसी से अपने फोन पे 45 minutes पर बात की, क्यों? The crux of it, zero, nil, कुछ नहीं. It was a wastage. And what you lost, well, that was your high energy time. इस टाइम पे आपने कुछ भी पढ़ लिया होता तो you could have learned it in such a way, but yes, it was waste. The thing what was shown in 3 Idiots, सबके वो नीचे जा के वो मैगजीन डाल के आता था. What was that? It was a distraction. It was a distraction. What is this social media? It is a distraction. और Netflix वगैरह पे serials आती हैं. All those serials. I mean, if you really see that, so what are they trying to do? They are trying to hijack your mind. They are doing exactly like that. I mean, don't take me wrong, right? But there was one serial in which the father was insisting that, beta, you should go in IIT. Right? You have got the capability. Why? Because father was IIT. So he said, yes, if you do that, then the level of respect which you get, that is phenomenal. The son, right? He said, nahi, mujhe to padhai nahi karni. Right? I want to do business. And then they are talking about all those startups and this and that and everything. And they are giving the examples of Bill Gates. They were all dropouts. The question, and the serial ended in such a way that when this father is telling, yes, beta, I was wrong, you do whatever you like. Fast forward your life to plus 25 years. Right? Fast forward your life. Right now, just for the sake of convenience, I'm writing this number. I know all of you must be about 18, 19, right? But समझने के लिए 20 plus 25. Now you are at the age of 45. You are at the age of 45. Your kid is in school, right? Is in college. पढ़ाई कर रहे हैं. And if that kid tells you have become one of the finest doctors, your practice is going good, you are in some good hospital, and then will you tell your kid कि हाँ बेटा तुझे नहीं पढ़ना तो मत पढ़ना, बाप के पास बहुत पैसा है, माँ के पास बहुत पैसा है? Will you do that? The thing is, it is your experience which matters, boss. It is this experience. It is this experience which will matter. कि मैंने 25 साल, right? I've seen the life. I'm not at all against any of the current generation. But in just before some time, I was talking in a college. When I said that, yes, they said we believe in smart work. I said, so you see, the smart work is like, you do the things smartly, but yes, for that you need to do hard work. So when you are doing this, when you are giving heart and soul to the subject, that subject starts loving. That subject will never leave. So when you are in trouble, when there is a complicated case, suddenly you will find that that patient himself is giving some indication that I am having this disease. Or all these are routers and switches, right? All this complete rack is there. So it happens like out of these hundreds of routers, suddenly which router, which firewall is indicating there is a light blinking. The problem is there. And people say that इतनी जल्दी diagnosis हुआ कैसे पता चला? Don't know. But when you love your subject, this is something which happens. And this I'm telling you from the experience. Don't ask me about the science behind it. I don't know really. But yes, it happened in this Ultratech cement when they were there was a major technical issue in that. There were 18 experts, right? They were working since 15 days. They were unable to figure out the solution. And God's grace, right? I don't say it was it took 20 minutes. It took 20 minutes. We just corrected that script and the entire system started. So the point is, love the subject love you. Bas. Nothing more than that. Okay? So this experience matters. Experience matters. Many of the things which are mentioned in the book, to समझा दी. But when it comes to something like बेटा जब ECG ऐसा हो ना, तो it is 100% the septal defect, septal infarct. And if it is septal infarct, then patient is in deep trouble. Attend that patient first. And now imagine you are into the cardiology ward, you are watching, and the moment on monitor you see one thing, you say, "Arey, sister, take care of this patient." So all those things, they are important. So when it comes, when your brain is ready to absorb, and all these social media, they leave nothing but to spoil your brain. कुछ बाकी नहीं रखते. When you stay away from them, then I told you, I met a girl in Delhi. She was posting over 600 messages every day, having a cup of coffee. Coffee is good. It is not warm. And then people like it or don't like it. And then if there are less than 1,000 likes, she'll throw her dress. Bekar dress hai. 1,000 like bhi nahi. Right? That's right. Yeah. She met me in aircraft. That's right. You got good memory. So say this is what really happens. So for time management, कुछ ज्यादा ज्ञानबाजी नहीं. Stop the wastage and leakage. बस. कोई बकवास नहीं. The moment you find in diary, this is the reason when I write what I wrote into my diary. I mean, so many females are there, तो ऐसे नहीं बोलना चाहिए. But yes, मैं तो बिंदास गाली लिख के मेरा 2 घंटा आधा घंटा वेस्ट किया है, 15 मिनट वेस्ट किया है. And then immediately that person's name, right, the name, and उसके सामने, right, लिख भी देता था TW is time waster. And then मस्त झूठ बोल, right, कोई टीचर नहीं सिखाएगा, but मस्त झूठ बोलना, right, the moment you know, हाँ फोन उठाने, अरे बॉस अभी बस मैं ना I'm just boarding the flight, मैं लैंड होके फोन करता हूँ, बस कुछ भी. Don't give your time to these people, because कितने भी करोड़ आपके पास हो, can you rewind even 5 seconds? Can you go back 5 seconds? नहीं ना. आपकी लाइफ में से वो टाइम गया, gone forever. And people, they are very much interested in wasting your time, because they know that if they can waste your time, so you will not progress. There is always a hidden bad intention. So take it like that. ठीक है. People will say कि बड़ा arrogant है, बड़ी arrogant है, ऐसी है, वैसी है. Who cares? Who cares? तकलीफ पड़ेगी ना, कोई नहीं आएगा. Right? So बिंदास. And I don't mind even showing you TW लिखा है कितने लोगों के पीछे, कितने लोगों के पीछे, time wasters. तो वही तो पुरुष मतलब अपने फोन में TW लिखना शुरू कर दो, राइट, मस्त मतलब बोलो. कोई भी हो, अरे मैं अभी बाहर से आई, मैंने अभी खाना नहीं खाया, मैं खाना खा के फोन करूं, no one would be able to say. बिंदास अवॉइड मत करना, then don't call back. because there will be a new bahana, kuch naya bahana. So that way, you'll be able to save time. And when you have got time now, enough time with you, so then automatically you'll be using it productively, or you are writing it, right? And इसके अंदर मस्त लिखो सब कुछ कि आज क्या क्या बहाने बन. I make very creative bahanas, very creative. मतलब वो ध्यान भी रखता था कि एक ही बहाना दूसरे को रिपीट ना हो. आर्या, क्या फर्क पड़ता है? तू बोली ना, that's why I'm telling you. I'm telling you, previously I used to get not less than 100 calls. और अभी जो मैसेज आते हैं ना, they are from bank कि ये इन्वेस्टमेंट हो गया, वो इन्वेस्टमेंट के पास, बाकी no one calls. क्या फर्क पड़ता है? Because the day you will be in trouble, right? कोई नहीं हेल्प करेगा. There will be only few selected ones. That's what is needed. And if someone respects you now, so they won't be disturbing you unnecessarily. कभी disturb नहीं करेंगे. The moment you can tell them genuinely, I do tell to few, my very close group, only few, I can tell them कि यार मैं बुक पढ़ रहा हूँ, right? तुम मुझे आधा घंटे के बाद फोन करे, अभी मुझे पढ़ लेने. And person would say no problem, immediately phone disconnect. Then it's okay, you talk to that person and then say कि क्या पढ़ा, right? And then you are talking something sensitive, right? अरे दोस्त, यूजलेस कॉल अगर जो कट करना सीखो ना, you see कितना टाइम लगता है. This is the secret behind it. This is the secret behind it. And वो मस्ती नहीं थी, वो 3 Idiots में वो जो बुक डालता था. People do that. Maybe now in a digital way. क्या यार, पूरे व्हाट्सएप में तरह तरह के एक साथ डिलीट मारो, डिलीट क्या करना है देख के. फिर कहेंगे अरे मैंने मैसेज किया था आपने पढ़ा भी नहीं. अच्छा रियली? सॉरी पता नहीं. बस. Regarding the low physical and mental energy, very genuine point for the energy. First, we'll talk about the physical energy. If you feel like that you are very tired, there are only 4 reasons behind it. 1, you are taking more carbs. You are taking more carbs because when you take more carbohydrate, that carbohydrate will lead to more generation in the sugar. Right? And when sugar comes, insulin spikes. Gradually, person becomes insulin resistant. When person becomes insulin resistant, problem. His muscles, they will be craving for it, right? And unnecessary glucose circulation will lead to inflammation and all complications. Diabetes वगैरह तो बात की बात, पर उससे पहले कितनी सारी और चीजें हो जाती. So, increasing carbs, this is अब कितना dangerous. You all being a medical student, that's why I can take a liberty to speak these things. Increased carbs, increased level of glucose, that starts affecting the important vessels. This is one of the reasons that in younger generation, you will find that they are having so many sexual problems. They are unable to satisfy their partner because the level of erection, that is never to that level. All those problems of erectile dysfunction, premature ejaculation, all those things, the culprit is high carbs. High carbs. Digital note and physical note, अरे दोस्त, डिजिटल नोट मतलब आईपैड या अपना आपका फोन या आपका लैपटॉप, they are digital notes. फिजिकल तो फिजिकल. मैं टोटली, अगर जो आपको पता है, इफ यू नो कि आपकी बुक कोई नहीं देखने वाला, तो फिजिकल इज ओके. बाकी नाउअडेज तो वो मेरा एक्सपीरियंस था, मतलब पीपल जज यू, यू रोट दिस थिंग, ऐसा लिखा, हाँ लिखा. How to know what is high carbs? Watch the ingredients. Watch the ingredients. High carbs is one of the most dangerous things, right? So avoid it. This is same, this is true even for females, right? We'll be discussing more about it. It affects females also in a very bad way. Take more proteins. You need to take care of your brain. Message me. Message kya? Send a mail to me. Right? If you want to gain weight, so more protein, because there are so many questions in that. Same day, right? Just message me how much rice or chapati. Can't answer this thing. You have to calculate it as per the body weight. But right now, what I'm telling is, try to cut the carbs, take more proteins. You'll automatically feel fresh. And कहीं पे भी जाएंगे दुनिया में, you'll always find veggies, green vegetables. Especially in these countries, so it is pretty good, right? Especially when I was in Georgia, मतलब मस्त vegetables मिलते हैं. So good, so fresh. Been to Georgia, Tbilisi 4 times, so absolutely fine. Right? So ज़्यादा नहीं इतना, and then 10 minutes of exercise. 10 minutes exercise. कुछ नहीं सूझे, कुछ नहीं. Just do jumping, running, spot running, whatever. Keeping this formula in mind. 220 minus your age. Right now, we just consider your age is 20, so it comes to 200. 80% of it, that becomes, so we just deduct 40, so it becomes 160. Take your heart level to 145 to 160. This should be the range. Remain in this range for 20 minutes and then do whatever you want. Jumping, running, this, that, skipping. Keep this thing. If you do this, your heart and lungs, they will remain in the best of the condition. So much so that when you'll be reaching to the age of, say, someone who is of the age of 40, so the calculations would change. You know? So 200 minus 40, that comes to 180, and you deduct 20, so you deduct 36 out of it, it comes to 144. So can't they take it more? Yes, if you condition your heart, you can take it even to 180, 190 without any problem. And still your heart will be beating effectively. So when we run in marathons, yes, our heart rates, they reach to 180, but no problem. So this is what is called as your fitness age. This is what is needed. So start conditioning your heart right from the beginning. 10 minutes, कोई भी निकाल सकता है, but it is not that big. So this is physical. Regarding the mental, commonest problem, B12 deficiency. B12 deficiency. This is commonest. So easily available, itni sasti hai, there is no so cheap. Right? So just you can take one sublingual tablet. Sublingual means you put it under the tongue and it will melt. Right? It is the fastest way of absorption because you are bypassing the liver circulation. Otherwise, it goes into the stomach. From stomach, it gets absorbed, comes to the portal circulation. From there, it goes to the liver. Liver metabolizes it, then puts it into the inferior vena cava, and then it goes into the circulation for the rest of the body. When you are putting it into the sublingual mode, it is straight away absorbed by your circulation and it is into it. So your tissues, they use it instantly. So sublingual is surely good. Right? One sublingual. Sublingual is under the tongue. Under the tongue. Knock knee is fixable. Need to see the X-ray because knock knees. Right? It is called as the genus valgus. So when the knees are knocking, right, when they are touching each other, they need to see the X-ray. Nothing big, right? This is the femur. This is tibia. That's fibula. Right? This is femur, tibia, fibula. So you need to see that this is because of the bones, is because of those collateral ligaments which are present over there, or it is because of these meniscus. Any of the things. If the X-ray is not revealing anything, in that case you need to go for MRI, because then we need to see these menisci in more detail. But in most of the cases, so a simple plain X-ray, right? X-ray, EP and lateral, right? And you need to take both knees. So you'll be requiring 4 moves, right? For right knee, epilateral, left knee, epilateral. Okay, and regarding the future part, काफी क्वेश्चंस पूछे थे. देखो, regarding the future, one sentence में आज तक कोई भी डॉक्टर जॉबलेस नहीं और भूखा नहीं मरा. नो डॉक्टर इज जॉबलेस, none. कहीं ना कहीं तो जॉब मिल ही जाती. Yeah, that depends upon their capabilities, but they are never out of the job. Requirement is so much, right? There is such a high requirement. So this is that secure. Regarding the respect, well, totally depends upon you. If people do wrong things, तो फिर वो डॉक्टर हो या कुछ भी हो, that all respect is vanished. But remain a good person, right? Don't complicate the things, and definitely you'll be getting the respect. And that sense, right? आपकी emails में कितनी बार आता है कि you want to help people, right? It's a very good thing. जरा भी गलत नहीं है to earn money. There is nothing wrong in it. Definitely you can earn. And yes, doctors, they are the highest paid. They are highest paid. Yes. मिलता है इतना. साल का $1 million, 8-10 करोड़. What books for first year? For anatomy, PD Chaurasia. Henry Gray, must, एकदम बढ़िया book, but they are reference book. And there are 4 volumes. ये 4 volume एक ठीक से आ जाए ना, no one can beat you. For embryology, Mbbs, that is very good book. No doubt there are other books also. IBS, Mbbs. There are other books also, but this is something which I have read. Then physiology, you go for Sambulingam, right? That is good. And Guyton, this is my all-time favorite, Guyton. But in Guyton, things are like storybooks. Doctors can buy cars like Lamborghini, मतलब आराम से. In Georgia, if they are using any of the Vishram Singh book is also good. Vishram Singh is good. See, whatever the books which what they use in Georgia. So these are such standard books. If you know this much, right, that is more than enough. Pediatrician have a good future in India, हाँ बिल्कुल. But दोस्त मेरे USMLE क्यों करनी है? If you want to settle in India, then why do you want to spend so much and working for a few years in USMLE? नहीं, एक बार US में काम करना शुरू किया तो फिर you will remain there only, and there is nothing wrong in it. जब वापस आओ तो it's come like a बादशाह. I'm into See, Sally, I'll answer this question. Engineering and medicine. Right? Even if someone is doing the AI, artificial intelligence, no way there can be any comparison between what is getting paid to doctor and an engineer. So if someone is telling you that engineers are getting more paid and they have got more opportunities, then very sorry to say they don't know about the medical science. They really don't know about the medical science. Rishikesh, this is now I'm telling you just before we finish for today. What you wrote is yes. Earn in dollars, spend in rupees. Then you are the richest person. वहां जाके is the amount money gets multiplied so many times. I've been to about 17 countries, and it was needed to come out of that pain. So regarding the future, don't worry. हाँ, तो अब देखो यार, अब जो जिसने जस्ट 10th पास किया है, why are you listening to that person? मतलब it is exactly like इंटरनेट पे यूट्यूब पे देखोगे ना तो then there are few videos. मतलब अब तो लोगों ने हद कर दी है, एक दिन में 5 किलो वजन कम करें. हाँ, अब तक तो चलो था कि 10 दिन में 2 किलो वजन, 15 दिन में चलो 3 किलो 5 किलो, अब तो एक दिन में. There are such videos. And then finally what they will say, that at the end they will say कि you have to keep your diet in control and then you have to exercise, और ऐसा करोगे तो एक दिन आपका वजन कम हो जाएगा. So stay away from all these people. इसीलिए when you write your diary ना, in that diary you write those best of the best things, because when you go back to that it will be so inspiring. Good question. Your eyes, they are most important. Okay, so simple eye exercises, the best eye exercises, just stretch your hand, right? If there is pencil, focus on that till it gets blurred, then once again far, blurred, take it far. So and then side to side, right? So these two exercises, and keep washing your eyes very regularly with cold water. Bas, nothing more is to be done. You can use artificial tears. It is called as artificial tears. These are needed, especially if you start getting dry eyes. If you start getting dry eyes, right, आँख में जलन शुरू हो, redness शुरू हो, so then you can use these artificial tears. But if you really take care of your eyes properly, तो ये नहीं होता. There are so many pros and cons of Vishwa Medical Admission. There would be few people, right, which will be telling कि नहीं मेडिकल तो करना ही चाहिए, करना ही नहीं चाहिए, इतने साल ये वो. ठीक है, everything has got its plus and minus. So to take care of your eyes, to take care of your eyes. बिल्कुल, people judge you when you say that you are doing MBBS outside. They feel that yes, you are like not up to the mark. Yes, people would say that. Why to discuss that? My all cousins are in medical field. Super. Dinesh, take care. You need to take care of your eyes. Start taking retinol, vitamin A. Vitamin A means the tablet of vitamin A is 7 rupees. 7 रुपए का 10 गोली मिलता है. No one should be suffering from vitamin A deficiency. Gajar khao. But in case if it is not available, so just take this vitamin A. 50,000 units. Chewable tablets. In case if there is vitamin deficiency, you can take if there is deficiency. All right. So, for any of the further queries, anything you want to ask, right, just let me know. Send a mail, and we'll be starting with cardiology next time, and we'll be starting with the conduction system. From conduction system, we'll be moving straight away to ECG. So that every time when we'll be discussing any of the disease, when I show you the ECG, you'll be able to decipher that yes, this is something, this is a P wave, and now this QRS complex is coming late. So this is because of the SA node, and this is when it crosses the AV node. So there is some delay which is occurring over here, right? You'll be able to visualize. Yeah, people are like that. Don't get hurt. Look at saying. When do we need to buy a stethoscope? Rishikesh, as far as I know, consultants they are giving you the stethoscope. Sally, you have sent me the picture. Huh? Most probably, they will be giving you the stethoscope, and it was a reasonably good stethoscope. So you can just ask for it. It was a good. So, जब stethoscope मिल गया तो start listening to your heart. शुरू तो करना. And to differentiate between heart sound and respiratory sound, breathe normally, listen to yourself, right? And then stop the breathing for a while and then try to listen. Is there any change? Because when you breathe, as the air goes, they are called as the breath sounds or the respiratory sound. Respiratory sound. And what comes from heart, they are the cardiac sound. Collectively, it is called as the auscultation. Normally, auscultation means people consider that it is the heart sound. It is combination of both. Achha, your cat also? Dinesh, you can take that. That is fine. Absolutely. Cat's heart rate must be very high because the smaller the animal, higher the heart rate. Because all these cat family, their heart rates, they are extremely high. Because cheetah's heart rate, when it runs behind a Thompson gazelle, his heart rate reaches to 400. That's the reason cheetah can run for only up to 400 meters. Within the 400 meters, if it can kill, that's fine. Otherwise, it has to stop. Because heart rate that shoots to about 400. There is a fear of going into the animal heartbeat transparent after their death. Animal heartbeat transparent after death. No idea. This I'm hearing for the first time. So I don't have any idea about it. Maybe you're talking about cold-blooded animal and warm-blooded animal. As a transplant, I mean, yeah, that was done in past when the monkey's heart was transplanted, but that was only for the experiments. All right. So take care. And thank you so much. And we meet soon. Right now, for the stethoscope, just listen from the diaphragm. Just from the diaphragm. After that, I'll show you that how to rotate, and you have to just touch it very delicately for all those subtle frequencies. Those frequencies which are very soft, especially the mitral stenosis. Okay. Wish you also a very great day ahead. Thank you. Take care.